Have you ever wondered whether some habits that seemed harmless in your younger years might actually be impacting your health now that you're older? It's common to reflect on things like diet, exercise, and daily routines as we age, but there's one topic many seniors rarely discuss openly: masturbation. Yes, that's right. You might be surprised to learn that something considered natural and healthy for most of your life can take on a different significance as you reach your golden years. Now, before we dive into this, it's important to understand that masturbation itself is not inherently bad. In fact, it's a normal part of human sexuality and can even offer some health benefits when practiced in moderation. But as you age, your body changes in ways that can make certain habits, yes, even masturbation, more complex than they once were. And that's exactly why doctors are beginning to pay more attention to this topic, especially for those over 70. So why are doctors talking about this now? Why is it suddenly a concern when it wasn't before? The truth is, it's not just about the act itself. It's about how your body responds to it at an older age. Changes in circulation, hormonal levels, and overall physical health can mean that something once harmless might now be putting unnecessary strain on your system. And that's where things get a little tricky. One of the first things doctors warn about is the potential strain on your cardiovascular system. You see, during masturbation, your heart rate increases, blood pressure rises, and your body enters a state of heightened physical activity, even if just for a short time. While that might have been manageable when you were younger, for someone over 70, especially if you have underlying heart issues, this sudden spike can sometimes be risky. There have been cases where seniors experienced heart palpitations or shortness of breath afterward, and while that doesn't mean it's universally harmful, it does mean caution is needed. Another concern that doctors have pointed out is related to joint pain and muscle strain. You may not think of masturbation as physically demanding, but repetitive motion, even subtle movements, can lead to soreness or discomfort, especially if arthritis or joint stiffness is already an issue. For some, this can result in lingering aches that weren't a problem before. It's important to listen to your body, recognize when something doesn't feel right, and make adjustments as needed. And let's not overlook the psychological aspect. Loneliness and isolation can sometimes lead to increased frequency of masturbation as a form of comfort or coping. While it might seem harmless, relying on it too much can potentially interfere with social interactions or even signal an underlying emotional struggle. Doctors emphasize that it's not about shaming the act but understanding the balance between healthy sexual expression and emotional well-being. Now, you might be thinking, I never thought of it that way, and that's completely understandable. Many of us grow up thinking that habits developed in younger years will naturally carry over without issue. But as your body and mind change, so does your relationship with yourself. The key is not to feel embarrassed or ashamed, but to be mindful of how your habits impact your overall health and happiness. It's also worth mentioning that hormonal changes play a huge role in how your body reacts to sexual activity. After 70, both men and women experience a significant drop in hormones like testosterone and estrogen. This decline can affect not just libido but also how your body recovers after sexual activity. Some seniors report feeling unusually fatigued afterward or noticing soreness that wasn't there before. Doctors suggest taking a slower, more relaxed approach rather than rushing through the experience, allowing your body to adjust and recover at its own pace. Another point to consider is the potential impact on sleep patterns. Many seniors notice that instead of feeling relaxed and sleepy afterward, they may experience restlessness or difficulty falling asleep. This could be due to changes in brain chemistry, as the rush of dopamine and endorphins may not have the same calming effect it once did. If you notice that your sleep is disrupted afterward, it might be worth exploring ways to manage this, like changing the time of day you engage in the activity or incorporating calming practices like deep breathing or light stretching afterward. At the end of the day, the goal here isn't to discourage you from expressing yourself or enjoying your own company. It's about being mindful of how your body has changed and adapting your habits to support your health and well-being. Just as you might change your exercise routine or diet to suit your current needs, it's okay to reassess this part of your life too. We're just getting started exploring this important topic, and there's a lot more to discuss. We'll dive deeper into some surprising factors that most people don't consider and practical advice on how to maintain a balanced approach to self-care as you age. Now that we've started to unravel some of the surprising aspects of this topic, it's essential to understand that not every senior will experience the same challenges. Bodies age differently, and what may be perfectly manageable for one person might present complications for another. However, being informed can help you make choices that support your overall well-being. Let's talk about something that's often overlooked: balance and coordination. As you get older, maintaining stability becomes increasingly important. One of the risks doctors point out is that sudden movements or certain positions during masturbation can increase the likelihood of falls or strains, particularly if you're already dealing with mobility issues or balance concerns. Imagine being in a position where your muscles are tense, your breathing is faster, and you suddenly lose your footing or strain your back. It's not something we often think about, but it's a real concern as your body becomes less resilient to sudden movements. Another point doctors often discuss is the impact on prostate health. For men over 70, the prostate gland naturally enlarges, which can cause urinary issues. Some studies suggest that frequent ejaculation can either help relieve symptoms or, in some cases, exacerbate them, depending on the individual's health condition. The takeaway here is that if you're experiencing frequent urination, discomfort, or any unusual symptoms, it's crucial to speak openly with your healthcare provider. They can help determine whether changes in your sexual habits might be affecting your prostate health. Now, let's shift the focus to mental and emotional well-being. Sometimes, the way society discusses sexuality in older adults can make people feel embarrassed or even guilty about natural desires. This guilt can lead to stress or anxiety, which is counterproductive to overall health. Remember, acknowledging your feelings without judgment is the first step towards maintaining a positive relationship with your body. Doctors also emphasize the importance of moderation. Just as with any activity, whether it's physical exercise, eating sweets, or even socializing, balance is key. Overindulgence, even in something as personal as masturbation, can signal underlying issues like anxiety or loneliness. If you notice that it's becoming a coping mechanism rather than a source of enjoyment, it might be helpful to explore other ways to fulfill those emotional needs, like connecting with friends or engaging in creative hobbies. One surprising aspect that some seniors might not realize is how changes in circulation can impact sexual activity. As blood flow decreases with age, it's common to experience slower arousal or even discomfort. While that doesn't mean you need to give up on intimate moments with yourself, it does suggest that taking things slowly and being mindful of your body's signals is more important than ever. Trying to force your body to respond the way it did decades ago can lead to frustration or even minor injuries. Let's not forget the importance of hygiene and self-care. As skin becomes more delicate and prone to irritation, using appropriate lubricants and gentle techniques can help prevent rashes or discomfort. Sometimes, simple adjustments can make a big difference. For instance, choosing products that are fragrance-free or specifically designed for sensitive skin can reduce the risk of irritation. Also, staying hydrated and maintaining healthy skin through moisturizing can make these experiences more comfortable and enjoyable. Another factor that might surprise you is the connection between sexual activity and bladder health. Some seniors find that masturbation can trigger the need to urinate more frequently or even lead to mild incontinence, especially if pelvic floor muscles are weaker. Strengthening these muscles through simple exercises, like Kegels, can not only improve bladder control but also enhance sexual satisfaction. It's a win-win situation that empowers you to feel more in control of your body. But here's where it gets even more interesting: the mind-body connection. Stress and anxiety can make sexual experiences less fulfilling or even uncomfortable. For many seniors, the fear of being judged or feeling embarrassed can create mental blocks that affect physical responses. Taking a gentle, compassionate approach to yourself can help ease this tension. Practice mindfulness, breathe deeply, and allow yourself to be present without judgment. The goal is to enjoy the moment without letting worry or self-consciousness take over. We should also address how medications can impact this aspect of your life. Many seniors take medications for heart conditions, blood pressure, or diabetes, which can affect libido or even make physical intimacy more challenging. If you've noticed changes, you're not alone, and it's nothing to be ashamed of. Speaking with your doctor can help you understand whether adjustments to your medication might alleviate some of these side effects. Sometimes, a simple tweak in your routine can make a significant difference. And then there's the social aspect. How often do we feel like we can talk about these things openly? In many cases, older adults may feel isolated, as if their desires are something to hide. But the truth is, acknowledging your needs without feeling embarrassed is a healthy part of aging. Finding a supportive community or discussing these topics with a healthcare professional who understands can make all the difference. One practical tip that many find helpful is creating a relaxed environment. Think about setting a calming atmosphere. Soft lighting, comfortable seating, and a peaceful mindset can reduce the risk of strain or discomfort. Plus, taking the time to care for yourself in this way helps cultivate a sense of respect and appreciation for your body, even as it changes. We're navigating a complex topic here, but it's important to remember that your well-being always comes first. Whether it's being mindful of physical changes, staying emotionally balanced, or adjusting your habits, every small step counts. Your health journey doesn't stop because you're aging. It just evolves, and understanding these changes empowers you to make better choices. As we continue, it's important to acknowledge one thing. Intimacy, whether with a partner or yourself, is a natural and personal experience at any age. The goal here is not to discourage you, but to empower you with knowledge that helps you make informed decisions. One aspect that's often overlooked is the impact on cardiovascular health. Engaging in any physical activity, including masturbation, can raise your heart rate. For most people, this is completely normal and not something to worry about. However, if you have a history of heart issues or experience symptoms like chest pain or shortness of breath during or after, it's crucial to consult your healthcare provider. They can guide you on safe practices and help manage any underlying conditions. Another crucial point is the mental aspect of desire and fulfillment. Sometimes, as people age, they might notice a change in their level of interest or satisfaction. This can be due to hormonal changes, emotional factors, or even medications. It's completely natural to go through fluctuations, and it doesn't mean there's something wrong with you. However, if you find that your feelings of dissatisfaction are affecting your mood or self-esteem, it might help to explore new ways of expressing intimacy or seek professional advice to navigate these changes. Let's talk about sleep. You might have heard that intimacy can help promote better sleep by releasing certain hormones. While that's true, some seniors find the opposite happens. They might feel more alert or even restless afterward. This can be due to changes in hormone levels, like reduced melatonin production, which naturally occurs with age. If this is the case, Try engaging in intimate moments earlier in the evening rather than right before bed. This small change can make a difference in how relaxed you feel afterward. Another point worth mentioning is emotional well-being. Sometimes, seniors may experience feelings of loneliness or isolation, and intimacy might become a way to cope with those emotions. While there's nothing inherently wrong with this, it's important to ensure that it doesn't become a substitute for building meaningful connections or maintaining social interactions. Balancing self-care with social engagement helps keep your emotional health in check. Now, let's focus on joint and muscle health. As we age, our muscles and joints may become more prone to stiffness or discomfort. Engaging in activities that involve repetitive movements or awkward positions can lead to muscle strain or joint pain, especially if you're not stretching regularly. Simple exercises like light stretching or gentle yoga can help keep your body more flexible and resilient, reducing the chances of discomfort. It's also valuable to touch on the topic of hydration. You might wonder how that connects, but staying hydrated is crucial for maintaining healthy circulation and skin elasticity. Dehydration can lead to muscle cramps or general fatigue, which can make any physical activity less enjoyable. Make it a habit to drink water throughout the day, especially before and after engaging in any form of physical intimacy. Let's not ignore the social aspect. Sometimes, seniors feel that their interest in self-pleasure might be seen as inappropriate or something to be ashamed of. But remember, aging does not erase your identity, desires, or needs. It's perfectly natural to still have an intimate connection with yourself. Surround yourself with supportive people who respect you for who you are. If you feel judged or misunderstood, it's okay to set boundaries and protect your well-being. Now, what about the emotional balance between intimacy and spirituality? Some individuals feel a sense of conflict between their personal desires and their spiritual beliefs, especially as they get older. This inner struggle can lead to guilt or self-criticism. It might help to reflect on your personal beliefs and speak with someone you trust, whether that's a spiritual advisor or a counselor. Finding harmony between your physical needs and spiritual values is a personal journey, and it's okay to seek guidance if you feel torn. One practical tip that doctors often recommend is listening to your body. If something doesn't feel right, don't ignore it. Whether it's a slight ache, fatigue, or just feeling emotionally unsettled afterward, take it as a cue to reassess your approach. Sometimes, small adjustments can make a significant difference. Consider setting a calming environment or incorporating relaxation techniques before and after to ensure a more balanced experience. Finally, let's address self-compassion. Aging can bring about a lot of changes, and sometimes we're hardest on ourselves. If you find that intimacy doesn't feel the same as it once did, remember that it's not a sign of weakness or loss. It's simply a new chapter. Allow yourself to embrace these changes without judgment. A positive mindset makes a big difference in how you perceive and experience intimacy. To sum it up, there's no one-size-fits-all answer when it comes to personal choices as you age. The key is to stay informed, listen to your body, and make adjustments as needed. Your well-being is the priority, and finding what works for you is a journey worth taking. Thank you for being here with us today. Your willingness to explore these important topics shows that you value your health and happiness. Remember, you deserve to live your best life, no matter your age. If you found this video helpful, don't forget to like and share it with others who might benefit from this information. Subscribe to our channel for more insightful content, and let us know in the comments if you have any thoughts or questions. We're here to support you on your journey to a healthier and more fulfilling life. Here's to living with confidence, Compa.